We're very excited to be hosting at SAfAIDS the first regional training of trainers workshop on social accountability monitoring for adolescent and young people's sexual reproductive health services and rights in Johannesburg this week.
We're really excited because we believe this is the first step to empowering young people. The overall objective of this TOT was just to empower them in terms of knowledge, skills, understanding on sexual and reproductive health and rights, number one. Number two, being able to design, facilitate and support social accountability monitoring in their respective communities.
This is within the Transforming Lives program supported by Sweden, and a 3-year program that will extend into 2021 and has brought together 6 countries from the SADC region who will comprise a pilot program component of this program around utilizing social and accountability monitoring mechanisms to collate data, analyze it, and translate it into advocacy actions that will unlock barriers, override challenges, and counter stumbling blocks for young people and adolescents within the national and regional platforms in terms of them accessing services.
So, as you can see, we're here in a Deep Street community today. It's part of the TOT. The participants are collecting data. They should feel confident using the scorecard. They should have the necessary skills and tools that they will apply back home. So today is a critical component, and we look forward to the learning.
So this has been the first training of the SAM champions for the region, and we hope that as they go back home, they'll be using the skills that they have acquired. And among these skills that they have acquired is advocacy skills, the social accountability skills, so that when they go back to their homes, they are now going to be monitoring service deliveries at facility level. We have added a very exciting component to this, which is the use of the mobile technology to assess or to monitor how service provision is done at a facility level. Of course, this is a very different approach from the other social accountability pieces that we are used to. It's based on generating evidence, and the evidence that they're going to be generating as they gather evidence at the facility level is going to fit in the overall Transforming Lives project, which is going to inform policy development and advocacy with regards to prevention of teenage pregnancies, safe abortion, among our focus areas in the Transforming Lives project.
The uniqueness of this training of trainers and eventual subsequent pilot program, which is being tested across the SADC region under the Transforming Lives initiative, is that it is focusing specifically on adolescent and young people's sexual reproductive health services, specifically looking at access to sexual gender-based violence, prevention, support and care, safe abortion and post-abortal care services, prevention of early unintended pregnancy, including family planning and related services, as well as HIV services access.
What this training really means for me and my fellow young people back in Zambia, it means that young people have been trained into being SAM champions, and the only thing that has been left now for me is that I need to cascade the information that I've learned here and be able to take it to the young people, so that the young people, and including myself, will be able to implement the social accountability monitoring program back home.
Well, as a young person from Malawi, I'll be able to impart knowledge that I've gained here to my fellow young people back in Malawi, but also looking at what we did using the balanced scorecard that we use in one of the community here, doing the work practically to make sure that as trainer of trainers, we should be able to know what really happens on the ground, but how best we can also share the knowledge that we gained here to our fellow young people back home. But also from the training, we'll be able to make sure that resources that belong to the young people belong to the young people on issues to do with sexual reproductive healthy rights.
So, but what was also interesting in the training is that we were able to use a mobile app to be able to get information, and the young people will be able to train young people to use the app and able to, if they want to complain about something, if they went to the clinic and they couldn't get the services that they wanted, they'll be able to put that information on the app and request for the services that they want. But also I think in using the app, the use of technology is very important. We know that young people in all these countries, in Southern Africa and everywhere else, young people use technology for a lot of things. And introducing the app for SRH services, for me personally, it was an highlight, and it's something that I'll be able to take back home and make sure that young people back home are able to use the app for social accountability monitoring.
And we anticipate that by collaborating with our regional and national partners from the 6 countries that have gathered, in the coming years, a movement will be built in the region to bring states to account and collaborate shoulder to shoulder with key stakeholders, not just ministries within states and government, but also members of parliament, civil society organizations, and youth-led institutions and bodies, towards attaining and realizing the commitments made in SADC to enhance service access and the rights of young people and adolescents to sexual reproductive health within the context of the SDGs. This is a policy-focused program, and the translation of the social accountability monitoring mechanism will be into advocacy, which then eventually translates into policy transformation that consolidates and affirms and honors adolescent and young people's sexual reproductive health rights in SADC.
Seven champions, transforming lives!